I'm going to reveal something that might shock you, or even shock your life. Have you ever literally ever wondered why your blood pressure stays high even though you're doing everything right? You eat healthy, you walk every day, and you take your medications exactly as prescribed. Yet the numbers on that monitor barely budge. Here's what most people never get told. Cardiologists reviewing studies from Harvard Health and the National Institutes of Health have found that millions of people over 60 are unknowingly taking everyday pills that quietly raise blood pressure. Many of these medications are meant to help with pain, allergies, or mood, but they can secretly work against your heart. You won't feel it happening. These pills don't cause an immediate spike. Instead, they slowly tighten blood vessels, cause your body to hold on to extra salt and water, and force your heart to work harder day after day. If your blood pressure refuses to come down, even with treatment, one of these common medications could be the hidden reason nobody's talking about. I'm Dr. Robert Casey, and now we're going to walk through 5 commonly used pills that research has directly linked to rising blood pressure and what safer steps you can bring up with your own doctor. Stay with me, because number 1 and 3 is a pill sitting in almost every medicine cabinet in country right now. If you find this useful, hit subscribe and turn on notifications. Comment 1 if you find this video helpful, otherwise 2, so I can know how to make better videos for everyone. Let's keep going. Let's start with one of the most surprising ones. Number 5, Advil, Motrin, and Aleve. They're the pills millions of people over 60 reach for when arthritis flares up, the knees start aching, or that familiar back pain comes back after a long day. They're sold everywhere. No prescription needed. Most people don't think twice about taking one. But here's what most people never hear. Those same pills can quietly push your blood pressure higher, and you won't feel a thing while it's happening. According to cardiologists at Harvard Health and the Mayo Clinic, pain pills from the NSAID family, non-steroidal anti-inflammatory drugs, interfere with how your kidneys manage fluid and salt. Normally, your kidneys flush out extra water and sodium to help keep blood pressure in check. But when you take these pills regularly, your kidneys start holding onto that fluid instead. That trapped water increases the volume of blood moving through your system, which makes your heart work harder to push it through your arteries. At the same time, the blood vessels themselves begin to tighten. The result? Your blood pressure slowly creeps up, sometimes by 5, 10, even 15 points, and you may never notice it happening. A large study from the American Heart Association followed adults who used ibuprofen or naproxen daily for just a few months. Blood pressure rose by several points on average. And in some older adults, that small rise was enough to trigger a dangerous chain reaction. More cases of heart strain, swollen ankles, and an elevated risk of stroke in those who already had high blood pressure before starting those pills. Now to be clear, these medicines aren't the enemy. Used occasionally for a headache or minor pain, they're safe for most people. The danger comes from taking them day after day, often without realizing the long-term effects. Some seniors take them almost automatically, like vitamins, not knowing those tiny pills might be quietly undoing all the hard work of their blood pressure medications. The good news is there are safer ways to manage pain that won't affect your pressure. Acetaminophen, gentle stretching, warm compresses, or anti-inflammatory foods like ginger or turmeric can all help. If you rely on pain relievers daily, talk to your doctor or pharmacist. They can help you find the lowest effective dose or a safer alternative. The American Heart Association estimates over 30 million adults in the U.S. use these pain pills every single week. Most have no idea what's helping their joints may be quietly straining their heart. So, before you reach for that familiar bottle again, remember, what seems like a simple fix for pain can carry a hidden cost. And speaking of hidden dangers, the next pill on this list is one almost everyone has taken during a cold. Cardiologists warn it can spike your blood pressure even faster. Number 4, cold and sinus pills. When you're stuffed up and exhausted and can't breathe through your nose, it's easy to grab an over-the-counter cold remedy. Brands like Sudafed, Dayquil, or certain non-drowsy allergy tablets all promise fast relief. What most people don't realize is that these pills can have a powerful effect on blood pressure, and not a good one. Many cold and sinus medicines contain ingredients called decongestants. The 2 most common are pseudoephedrine and phenylephrine. These ingredients shrink the blood vessels in your nose to help you breathe better. But they don't stop there. They also tighten blood vessels throughout your entire body, including the ones around your heart and brain. That tightening forces your heart to push blood through narrower openings, and your blood pressure rises, sometimes very quickly. A Harvard Health report explained it plainly. Even a single dose of pseudoephedrine can increase blood pressure by 10 points or more, especially in adults over 60 who already have hypertension or heart disease. For some people, that's enough to bring on dizziness, headaches, or a dangerous spike that ends with a trip to the emergency room. The Mayo Clinic has also flagged these medications for interfering with common blood pressure drugs. So while one pill is trying to bring your numbers down, the cold pill is pushing them right back up. Many doctors describe it as a tug of war inside your bloodstream. Your blood pressure looks controlled on paper, but for hours after taking these pills, it can climb quietly without you knowing. Even many sinus or multi-symptom formulas that seem harmless contain hidden decongestants. They're often labeled with a small letter D, like Mucinex D or Claritin D. That one letter can make a real difference to your heart. A 2023 study from the Cleveland Clinic followed thousands of older adults who regularly used over-the-counter decongestants during cold season. Researchers found nearly one-third experienced measurable blood pressure increases, and about 10% developed new heart rhythm problems during those months. Safer alternatives include saline nasal sprays, humidifiers, antihistamines without decongestants, warm fluids, steam inhalation, or a neti pot. If you absolutely need medication, look for labels that say decongestant-free. Your pharmacist can point you to the right ones. Cold and sinus pills are designed to help you breathe easier, but for people over 60, they can quietly make your heart work much harder than it should. The next time you catch a cold, think twice before reaching for the strongest sounding box on the shelf. And the next pill on our list, many people take it every single day for mood or sleep. New studies show it can push blood pressure higher in ways most doctors never fully explain. Number 3, antidepressants and sleep aids. This one often goes unnoticed when it comes to blood pressure. It might surprise you, but some of the most commonly taken pills for mood, anxiety, and sleep can gradually raise your blood pressure over time. Medications like Zoloft, Prozac, Paxil, and older antidepressants such as Elavil or amitriptyline are widely used by adults over 60. A 2023 report from Harvard Health noted that nearly 1 in 4 older adults in the U.S. takes an antidepressant or sleep medication regularly. And according to cardiologists at the Mayo Clinic, certain types of these drugs can quietly tighten blood vessels or interfere with the body's ability to regulate adrenaline, both of which push blood pressure higher. Here's what's happening inside your body. Your nervous system controls how wide or narrow your blood vessels stay, adjusting them constantly to keep pressure stable. Antidepressants, especially the older tricyclic types, can disrupt that process. They cause your blood vessels to stay slightly more constricted, which increases resistance and forces your heart to pump harder. Even newer antidepressants, the SSRIs like sertraline or fluoxetine, may slightly raise blood pressure in some people. The change is usually small, but for older adults who already have hypertension, even a small rise adds up over time. Then there's sleep aids. Pills like Ambien or antihistamine-based sleep tablets can slow your breathing and affect how your body handles oxygen and carbon dioxide at night. That imbalance triggers stress hormones that push your blood pressure up the next morning. A Cleveland Clinic study found that older adults who regularly use prescription sleep aids had higher average morning blood pressure compared to those who managed sleep naturally, and many of them had no idea their medication was part of the problem. Here's the part that surprises most people. There's no pain, no dizziness, no clear signal that something is wrong. It builds silently day after day. Doctors are clear. Never stop antidepressants or sleep medications suddenly. That can be dangerous. Instead, have a conversation with your provider. Sometimes a small dosage adjustment or switching to a different medication solves the issue. Natural approaches like light therapy, gentle movement, breathing exercises before bed, or magnesium-rich foods may also support better sleep and mood without affecting blood pressure. Mental health and sleep matter deeply, but the medications that help in those areas can sometimes carry hidden effects on your heart. If you've noticed higher readings after starting a new antidepressant or sleep aid, bring it up at your next visit. And the next group of pills might surprise you even more, because they're prescribed specifically to protect your heart. Yet in some seniors, they can quietly make blood pressure worse instead of better. If my videos are helping you understand your health better, subscribe now and share this with someone you care about. Every day we cover topics like this that most doctors simply don't have time to explain in a short appointment. Number 2, blood pressure and heart pills. This one might sound strange at first. How could blood pressure pills possibly raise your blood pressure? But, according to cardiologists at Harvard Health and the Cleveland Clinic, certain medications designed to protect your heart can sometimes produce the opposite effect in older adults. The most common blood pressure medications are beta blockers, diuretics, and calcium channel blockers. These are important drugs that have genuinely saved millions of lives. But in some seniors, particularly those over 65, the body reacts to them differently. Take beta blockers like metoprolol and atenolol. They're meant to slow the heartbeat and reduce the workload on your heart, which is appropriate after a heart attack or for rhythm problems. But when the heart rate drops too much, blood flow to vital organs like the brain and kidneys also slows. Your body senses that and tries to compensate by tightening blood vessels and releasing stress hormones like adrenaline. That chain reaction can actually raise your blood pressure instead of lowering it, what cardiologists sometimes call the rebound effect. A large study in the Journal of the American Medical Association followed older adults on long-term beta blockers who had no prior heart problems. The results showed no clear survival benefit, but a noticeable rise in dizziness, fatigue, and elevated blood pressure in some participants. Diuretics, often called water pills, are designed to flush out extra salt and fluid. But when used too aggressively, your body can lose too much potassium and magnesium, minerals your blood vessels need to stay relaxed. When those mineral levels drop, your arteries can stiffen and blood pressure becomes harder to control. Calcium channel blockers like amlodipine or diltiazem relax blood vessels and help blood flow more easily, but they can sometimes cause swelling in the ankles and feet, which the body reads as a fluid imbalance. The kidneys then retain more water and salt, pushing pressure higher over time. The truth is, many seniors stay on the same heart medication for decades, even as their blood chemistry, kidney function, and overall health have changed. What worked at 50 may not be right at 70. That's why doctors now recommend medication reviews every year after 60. Sometimes adjusting the dose or switching to a different drug entirely makes a significant difference in both blood pressure and energy. If you notice dizziness when standing, swelling in your ankles, or fatigue that seems worse after taking your pills, don't ignore it. Those are your body's quiet way of asking for a closer look. And that brings us to number 1, the most common type of medication that quietly raises blood pressure in seniors, even though it's prescribed to help you heal faster and feel better. Number 1, steroid and anti-inflammatory pills. This one surprises people the most. Steroid pills, medications like prednisone or cortisone, are often prescribed for arthritis flare-ups, asthma, allergies, or autoimmune conditions. They can feel like miracle pills. Within days, pain fades, swelling goes down, and breathing gets easier. But here's what most people are never told. Those same pills that bring fast relief can quietly push your blood pressure higher, sometimes within just a few days of starting them. According to Harvard Health and the Mayo Clinic, steroids cause your body to retain salt and water. That extra fluid builds up inside your blood vessels, creating more pressure against the artery walls. Think of it like slowly turning up the pressure in a garden hose. At first, everything looks fine, but over time, the constant force strains the whole system. A large study published in the British Medical Journal followed over 100,000 adults who used oral steroids for more than a month. Even moderate doses led to significant rises in blood pressure and increased risk of heart disease and stroke, especially in adults over 60. But fluid retention is only part of it. Steroids also disrupt the balance of hormones that control how your blood vessels expand and contract. When that balance is thrown off, your arteries tend to stay tighter and your heart has to work harder to push blood through them. The rise in pressure can be subtle at first. You may feel fine, maybe a little flushed or restless. But as the weeks pass, some people begin to notice headaches, swelling in the ankles, or sudden changes in their energy. Those can be early signals that the medication is adding extra stress to the cardiovascular system. And here's something that often surprises people. Many who take steroids for joint pain or inflammation are also on blood pressure medications, but the two drugs can pull in opposite directions. One trying to lower your numbers while the steroid quietly raises them back up. It's a tug of war that leaves many seniors wondering why their readings never seem stable no matter what they do. If you're taking steroids for more than a few weeks, cardiologists recommend checking blood pressure regularly at home. Reducing salt and staying well hydrated can also help limit fluid retention. And whenever possible, Ask your doctor about non-steroidal options like physical therapy, targeted anti-inflammatory foods, or milder medications. If you've been feeling more tired, swollen, or lightheaded since starting a steroid, don't dismiss it as just aging. Bring it up. A simple tapering plan or medication adjustment could make a real difference for your heart. We've just covered 5 of the most common pills that can quietly raise blood pressure in adults over 60. Pain pills like ibuprofen or naproxen, cold and sinus medications containing decongestants, antidepressants and sleep aids, certain heart and blood pressure drugs when not carefully managed, and steroid medications like prednisone that bring fast relief but can build hidden pressure inside your body. Each of these medicines can be genuinely helpful when used correctly, but taken long-term or without close monitoring, they can slowly work against the very organ they're meant to protect, your heart. High blood pressure isn't always caused by salt, stress, or genetics alone. Sometimes it's a side effect of a pill you've been taking for years without realizing it. That's exactly why cardiologists emphasize medication reviews after age 60. Your kidneys, liver, and heart all process medicine differently as you get older. What worked 5 years ago might be too strong or simply unnecessary today. If you take any of the medications we've discussed, don't stop suddenly or make changes on your own. Instead, bring it up at your next appointment. Ask your doctor one simple question. Could any of my medications be raising my blood pressure? That question alone could start a conversation that protects your heart for years to come. Take a moment this week to look through your medicine cabinet. Make a list of everything you take, including over-the-counter pills, and share it with your doctor or pharmacist. It takes just a few minutes, and it can prevent months or years of hidden strain on your heart. If this video opened your eyes, please share it with a friend or family member who takes any of these medications. It could genuinely protect their health. And if you haven't already, subscribe to this channel and hit the notification bell so you never miss an episode. I post new science-backed videos every single day to help you stay strong, active, and independent, no matter your age. Your health is your most important investment. Protect it, question it, and keep learning. Because every small step you take today can mean a stronger heart and a longer, healthier life.